Welcome to The Explainer. Today, we're diving into one of the most important roadmaps for a healthy life, antenatal care. Think of it as a journey, a partnership, and a proactive plan, and we're about to break down exactly what that all means.
So let's kick things off with a pretty big question. If you were going to build the foundation for the healthiest pregnancy possible, what would that blueprint even look like? Well, it actually has a name, and that's what this explainer is all about: antenatal care.
Okay, first up, let's talk about the main goal here. We're going to explore what antenatal care is, and, maybe more importantly, why this whole approach is so critical for building healthy futures for both parent and child.
So at its heart, antenatal care, or ANC for short, is the system of supervision and advice. But really, it's so much more than just a string of doctor's appointments. It's better to think of it as a partnership with your healthcare provider, a hands-on strategy that's designed to get the best possible outcome for everyone involved.
Now, what's so powerful about this is how it really lays out the why. You see, ANC isn't just about passively monitoring things. It's all about action. It's about spotting potential issues like high blood pressure or anemia way before they turn into serious problems. It's about arming you with the knowledge you need and, at the end of the day, getting you ready for safe and confident delivery. It's basically a comprehensive safety net. So, if this whole thing is a journey, then what does the map look like? Well, the good news? It's not guesswork. There's a really clear, evidence-based schedule that guides the whole process. Let's take a look at that timeline. This right here is the World Health Organization's recommended schedule. It's a model built around 8 key contacts during pregnancy. That first visit is absolutely crucial. It happens before 12 weeks to get a baseline during what is the most critical phase of organ development. And from there, all the following visits are timed perfectly to line up with key fetal growth spurts and the best windows for important screenings. It's all about making sure care is delivered exactly when it's most effective. This 8-contact model actually represents a huge shift in how we think about pregnancy care. The traditional way was all about frequency, monthly, then biweekly, then weekly visits. But this new model, it focuses on quality. It's about making sure every single one of those 8 contacts is packed with essential evidence-based interventions, instead of just being routine check-ins. It's a major move from quantity to quality. All right, so you've got your schedule, but what actually goes down when you walk into the clinic for one of these visits? Let's pull back the curtain and look at the essential checkups. Pretty much every visit is built on these 3 pillars. It all starts with history taking, which is just your provider getting to know your unique health story. Next up is a physical exam to check on your overall health, things like blood pressure and weight. And finally, the obstetric exam, which zeroes in specifically on the baby's growth and health. And honestly, one of the most amazing parts of that obstetric exam is this number, 120 to 160 beats per minute. That's the normal range for a healthy fetal heart rate. It's about twice as fast as an adult's. And I can tell you, for so many parents, hearing that steady, rapid beat for the very first time is one of the most powerful and reassuring moments of the entire pregnancy. So beyond the physical exam, routine tests give us this vital window into what's happening on the inside. Blood tests check for things like anemia, which can make you really tired, and your blood type. Urine tests can pick up early signs of issues like preeclampsia, which is a serious blood pressure condition, or gestational diabetes. And of course, the ultrasound gives us that incredible first peek at the baby's development. Now, this next part is so important. Antenatal care isn't something that just happens to you. It's a plan where you are, without a doubt, the most important player. Think of yourself as the co-pilot on this journey. Your active role is absolutely crucial. And a huge piece of that active role is nutrition. I mean, think about it. Building a whole new person takes some serious resources. A healthy diet is built on cornerstones like these: high protein for new cells, iron to support all that extra blood volume and prevent anemia, and calcium for a strong little skeleton. And of course, a good balance of fruits, vegetables, and water just keeps all the systems running smoothly. Some nutritional needs are so critical, they need a little extra help from supplements, and folic acid is the perfect example. Taking it, especially really early in pregnancy, is proven to help prevent what are called neural tube defects, and these are serious birth defects that affect the brain and spine. It's a tiny pill that has a truly massive impact. Your proactive health plan also includes protection. A simple 2-dose course of the tetanus vaccine protects both you and your newborn from tetanus infection, which is a really serious disease that can be contracted during delivery. It's a safe and super effective shield for you both.
Okay, so as the due date gets closer, the focus naturally starts to shift towards the destination, delivery day. This last phase of care is all about being vigilant, knowing the warning signs, and just being prepared.
So let's just pause for a second and ask a really critical question, because knowing the answer here could literally be life-saving. What are the urgent warning signs that mean you need to get medical help right away? First and foremost, any vaginal bleeding. This is never considered normal during pregnancy. It requires immediate evaluation by a healthcare professional. Seriously, do not wait.
Next up, a severe headache that just won't go away, or any changes in your vision, like blurring or seeing spots. These can be signs of a dangerous spike in blood pressure called preeclampsia, and it needs urgent attention.
And finally, a noticeable decrease in your baby's movements. You really get to know your baby's unique patterns. If that pattern changes in a big way, or the movements seem to stop, that's a signal to get checked out right away. You have to trust your instincts on this one.
Knowing the warning signs is one part of being prepared. Having a practical plan is the other. This is what a birth preparedness plan looks like. It's all about making those key decisions before an emergency happens. It means knowing where you're going, figuring out how you'll get there, and having your resources, both financial and human, lined up and ready to go.
So, after all the checkups, the tests, and the planning, what's the big payoff? Well, it's enormous. Consistent antenatal care leads to dramatic reductions in mortality for both moms and babies. It means catching diseases early, being better prepared for a safe delivery, and it even sets the foundation for successful breastfeeding. The benefits just keep rippling out long after the birth. And that brings us to our final and maybe most crucial thought. We've just walked through the blueprint for a healthy start in life. The evidence is crystal clear. So the question we're left with is this. Knowing just how powerful this care is, how do we make sure that this vital journey is something that's accessible to every single parent, everywhere?